At the end of the day, no one knows your body like you do. At the end of the day, doctors are doctors, but they are practicing medicine. They're practicing. So they will not know everything, but you know your body more than anyone else. Medical industry can do is to put more faces in the forefront.
Happy birthday to you.
Of people who are doing well, who are receiving the treatment, who have found their way, who are winners. Put people out there, not only from people who have won the fight. We need to see that the system cares about us. We need to see that, because for decades, we've seen so many systems that don't.
He had a picture in his mind of who I was and what my life was like. He already had his own stereotypical thoughts about who I was. I actually worked in the same healthcare organization that he worked in. He did not treat me well as a patient. Thankfully, because I'm a clinician, I was able to identify that right away. But I think that when you're talking about other people that are not clinicians, just lay people, or average people that are going to seek care, go with your gut. If you feel like something is not quite right, get a second opinion. You're entitled to a second opinion, and some insurance will even pay for a third opinion. Do not feel like you're stuck with that person. I never have been one to put all my trust in another human being. I felt like I needed to do my own research and have my own questions ready so that I know that I'm getting the best care possible. The experience I had with the urologist made it even more clear to me that my approach is the best approach for me. You have to do what's right for you. Get all the information that you possibly can, and then you decide what's best for you. And that's just the gist of it, because you're the one that's going to have to live with your decision.
I get it not infrequently that a Black patient will just say that they're happy to see me or someone that looks like me. It just reminds me that of the urologic workforce, it's less than 3% of us for all of urology that are African American Black. I think what it comes down to often for patients that see me is, for them, there is a shared life experience that we have that provides more comfort. That doesn't mean that other practitioners that don't look like them will not offer good care, but it does potentially provide a level of comfort that is not something that they've encountered before. So I'd say the key things that I try to tell everyone are, you need to feel comfortable with what's happening. If you're not feeling comfortable with the provider or the information, you need to feel comfortable. So if that means asking more questions of that provider, if it means finding other ways to get more information, like the Bladder Cancer Advocacy Network, if it means going through support groups or peer groups for others who've been down that road, getting more information is key so you feel comfortable. And sometimes that's a second opinion. Sometimes that's just, hey, can I ask this doctor a few questions in an informal setting? But at the end of the day, you have to feel comfortable. So whatever it takes for that, because people are already doing it.